Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Kayode Okikiolu. Here are some of the highlights. As economists try to recover from the impact of COVID-19, the Borno State government is asking citizens to share ideas on how to build the economy through budgeting. And we bring you the story of yet another COVID-19 survivor who shares his remarkable recovery story with us. And more countries battle a resurgence of the virus as South Korea records its biggest spike since March. We'll tell you where those cases are suspected to be coming from. Thank you for joining us on the program. Nigeria has recorded 7 new deaths from COVID-19, raising the total number of fatalities from the virus to 992. 14 of these fatalities are medical doctors who lost their lives in the line of duty. And latest figures from the NCDC shows Nigeria has now recorded a total of 50,964 cases of COVID-19, with the addition of 476 new cases in the last 24 hours. 37,569 of the total confirmed cases have been discharged, while 12,403 still remain active. A breakdown of the new cases across 17 states and the FCT shows Lagos reported 235, FCT 44, Kaduna 41, Borno 33, Plateau 28, Abia and Edo 13 cases each, Rivers 12, Imo 11, Oyo 10, Kano 9, Kwara 7, Enugu and Katsina 5, Gombe and Ogun 4 cases each, while Nasarawa and Zamfara recorded 1 case. But more survivors of the COVID-19 pandemic are sharing their experiences on how they battled with and conquered COVID-19. Mr. Nduka Omodo, who was recently discharged from an isolation center in Delta State, narrates his ordeal, yet another reminder of the existence of the virus and the high chances of recovery. Meanwhile, current figures from Delta State show the total number of confirmed cases at 1,646, active cases at 148, discharged cases at 1,452, and 46 deaths.
Well, mine actually started sometime in April with a fever, and it was persistent for a while. Took several anti-malaria drugs that never worked. Then, in between, I had difficulty in breathing. Along the same line, I had diarrhea, and it coughed out. It became very persistent. I had to go do the test, and the result came back positive. So I was asked to isolate for 21 days. Why the necessary medications were administered, by a team of medical professionals that we had in Delta State.
As at middle of July, nearly about 5,000, tests, have been conducted in Delta State, and the figure is still it's still being updated on a daily basis. So, if you follow the trajectory, if you follow, the trajectory as to the number of tests that is being done as at that time, and what we expect today, realize that the figure is actually increasing. We had that challenge wherein a lot of persons, even some educated persons who never believed that COVID-19 was real. What we're also doing that is really very critical in the fight is for us to be able to drum up advocacy and sensitization, on the need for the people to adjust their belief system to really accommodate the reality of COVID-19.
Well, the pandemic is still hitting economies across the globe, and here in Nigeria, the Borno State government is rolling over unattainable projects to the 2021 budget. During a town hall meeting with stakeholders in Maiduguri, the state's capital, the Commissioner for Finance noted that the state had earlier cut its 2020 budget by 26%, from 146 billion to 108 billion, and now it plans to make up for the cut in the coming budget. At the meeting attended by the State Deputy Governor Usman Kadafu, stakeholders advised the government to look inwards and seek alternative internal revenue windows.
By the Permanent Secretary, the 2020 budget projection of 146.89 billion was revised to 108.86 billion due to negative effect of our projected revenues as a result of the COVID-19 pandemic. The practical implication of this is that a number of projects and programs have suffered implementation challenges. I therefore urge the good people of Borno State to bear with this administration as we review some of the affected projects for rollover to 2021.
Actually, the presentation is sought from the civil society organization and the other citizens, because this is a citizens' budget we want to do. So you can see they have submitted their own presentation in a hard copy, which we are going to sit down and study very well. So, and then compare with the Tech Park agenda of His Excellency and see how we can marry the two for it to enable us present it in the 2021 budget.
Well, let's check in with graduate and senior secondary school students as they enter day 5 of their WAEC examinations. In Yobe State, the government has made it mandatory for students to wear face masks, among other safety protocols. And a visit to some schools in Damaturu, the state capital, reveals that only those with face masks are allowed into examination halls. The safety protocols were outlined to minimize the spread of the novel coronavirus among the graduating students.
Our safety measures we use during writing our exams, our teachers ask us to maintain social distancing when writing our exams, and we use our face masks regularly whenever we are going to write our exams. And we always use hand sanitizers to wash our hands.
Some of the safety measures are, you see my nose marks here, and by the gates you can see some of the hand sanitizer. They are being put in place there, and the running water with tap in order to wash your hands.
Well, ensuring people wear their face masks has been one major challenge in this fight against COVID-19 around the world. And Nigeria, of course, is not left out. In Bayelsa State, some residents have been speaking about their disposition towards the protective measure of wearing a face mask. Our correspondent, Dobra Timmy Wood, reports.
Social distancing and the regular use of a face mask, especially in a public environment, is one of the rules laid down by the NCDC to stop the spread of the coronavirus. I'm at the Apollo Market in Yenegua, and as you can see, there's absolutely no compliance with the social distancing directive. In fact, nobody, okay, I've seen one person. Only this man has been seen wearing a face mask in this market. We spoke with some traders on why they are yet to obey the directive to use the face mask regularly, and here's what they said.
Where no wear them, I get them. It worry me when I wear them. The mask now, never agree me to talk.
Like for me, if I wear the mask, if it breathe well, they take me uncomfortable.
Why I don't really like it is not because I don't want to put it on, but because it affects, for me as an individual, it affects my breathing system. Breathing out, breathing in.
As at the last update from the COVID-19 task force in Bayelsa State, there are only 7 active cases for the coronavirus in Bayelsa State out of the 352 confirmed cases. 324 persons have already been discharged, and the state has experienced 21 deaths. From Yenagua, Dobra Timiwood for COVID-19 updates.
Well, Dr. Feintola Ganiyu, a public health physician, joins us this afternoon to discuss some of the things we've seen in Bayelsa and across the country. Well, good afternoon. Thank you for joining us.
Good afternoon. Thank you.
Well, I mean, we just saw what's going on in Bayelsa, and I'm pretty sure that this is something you find across the country and even across the world. And we saw a cross-section of people, young, old, male, female, a lot of them not wearing their face masks. But when you put that side by side with the statement made that young people are driving the spread of COVID-19, how do they really intersect?
Yeah, they intersect because you see, if the young people, especially the students, not using the face mask and, avoiding the use of the hand sanitizers and washing their hands with soap and water when they get home, they can affect the elderly ones at home. And the elderly ones are the ones that come down with the disease the most because young individuals, their immune systems are still working very well, unlike the elderly ones. So if the young people are not adhering to the rules, it goes a long way in affecting the elderly ones, and the numbers keep on rising. So that's why we're admonishing the younger ones also to try as much as possible to use the face masks, sure they use their hands, alcohol-based hand sanitizers, and use of water and soap to wash their hands. Because if they don't do that, they go back into the community, mix with adults, mix with market women, mix with other people in the community, and as well, the virus keep on spreading and increases the number than we expect.
But it also appears as though the older ones are not adhering to the protocols, as you see there. I mean, there were 2 older ones saying, well, I don't wear it because it doesn't allow me to speak well and what have you. So, I mean, shouldn't the message also be holistic, saying yes, young people are driving it, but the older ones, you should also ensure that you adhere?
Yeah, it's very important, because the elderly ones think that because they've opened everywhere, they feel that the disease is no more as it was before. But we are still admonishing them and telling them to use their face masks, to use their hand sanitizers, because if they come down with the disease, it's actually very, very severe in them than even the younger ones. So the elderly ones shouldn't just, throw all cautions to the wind and try not to use their face mask and say it doesn't allow anybody to breathe well. But it's for their own good. It's for their own good, because if you don't breathe well and later on you fall down with COVID, if you mix 2 of them together, you see that being alive is very much important.
There was that analogy saying, if you think that face masks don't allow you to breathe, how about you try, what's that thing called?
The face shield?
No, the medical equipment that helps people breathe in the ICU.
That's the ventilator.
Exactly.
Yeah.
Right there. Now, another thing that is quite tricky about this is the fact that, you see that the Minister of Foreign Affairs, for example, says he wore his face mask, he wore his face shield, he washed his hands, he ensured he sanitized his hands. He had even this air purifier that people wear on their chests, and still he came down with the virus. And one wonders, you can actually ensure that you abide by this, and somehow this sneaky virus comes in. So
it's very, very possible, because you don't know where you might have touched, you don't know who you might have spoken to. It doesn't show on the face, and somebody may be asymptomatic and not show symptoms, and you just go into a garden, just for example, for a minute, you just put your face mask aside and try to converse with that person. It's a respiratory disease, so with a little time, you can just take it with symptoms, and it takes a while before it shows. It takes weeks. The incubation period is 5 to 6 days. So before somebody actually come down and feel ill, it can take a week or 2 weeks. So any place, it's possible for you could have picked it up in a very, very minute minute.
So never drop the ball.
You'll never drop it.
Okay, well, I'd also like to get your thoughts on this conversation around, the lasting effects of what happens after you recover from COVID-19. There's been talks about COVID-19 leaving people, with some side effects or some morbidities. What's the conversation around that?
Well, when you recover from COVID-19, the symptoms don't just relieve you alone. You could still have cough, you could still have joint pain, you could still have tiredness, what they call fatigue, just weakness in your bones and in your muscle. But it doesn't mean that you still have the disease, you understand? It's just some of the symptoms, especially if you were really severe, it really hits you very much while you had the disease. So we just admonish and try as much people to manage the symptoms, but when you start feeling feverish again and, headache, cough, like how you were feeling before, in that case of situation, you should report yourself. But when you recover from COVID, some of those symptoms might still be within your system, and we're trying to let people know that it doesn't mean you still have the virus, but just that it can take a longer while, especially if yours was very severe. It could affect you breathing very well as much as
so nothing really life-threatening, because there were talks about the lungs being affected.
I know, you have some life-threatening ones. It could affect the lungs, and especially if you have a ventilator initially, so it causes some scar tissues in the alveoli and, makes difficulty in you for breathing. Then it could also affect the brain. It could also affect the heart, the muscle of the heart. So those 3 major organs could be affected on the longer run, but, studies are still being going on while the longer term effects could cause or could manifest in person. They're just trying to, similar to some of the viruses that's like the influenza virus, the longer term effect of what that could cause. So trying that to put into COVID also, we are not so sure, but studies are still going on to find out what the longer term effect, but they have seen that the lungs, the heart, and the brain could be affected.
Okay, final thing, in just about 10 seconds. So there's been a conversation, moral persuasion or enforcement. What is the way to go?
I think both. yes, both frustration and
I saw that coming really stay in the middle. Well, thank you so much, Dr. Fain Talagani, public health physician. Thank you for your thoughts this afternoon.
Thank you for having me here.
Well, South Korea's COVID-19 rate has not been this intense since March, and we'll bring you more after the break. Please stay with us. Welcome back. The 2020 World Humanitarian Day may have come and gone, but the footprints today left in the primary healthcare sector in Cross River State should linger for a while. Well, one of its healthcare facilities in Adiabo community got a facelift sponsored by an aide to the governor to boost the morale of the staff of the facility in the fight against COVID-19 and the increasing figures in the state.
Have a functional healthcare system is not just a responsibility of government, it's everyone's responsibility. We know very well that it's expected that government should be the one to take the lead, and I'm glad that His Excellency Senator Professor Benayade is already doing that. And you will agree with me that especially this COVID period where a lot of things have been crumbled or crippled, right now everyone is trying to see how we can try as much as possible to fix all the necessary things that need to be fixed and improve quality healthcare services.
Try to wash your hands, try to sanitize. If you go for medications, you try to tell the doctor accurately what is wrong with you. You don't try to hide it, And when you go out there, you try to show that humanitarian act. You try to be nice to these health workers. They also have families they've left behind. So you don't go there and you're rude and you expect them to just be at your service. There's protocol. So you try to oblige this protocol. You try to be nice to them. In any little way you can support them, it will really go a long way.
To Germany, where new figures show a drop in the number of businesses filing for insolvency during the first half of 2020. And that's despite pandemic lockdowns and a record recession. Berlin suspended insolvency proceedings until September and was hoping that hard-hit businesses will regain their footing. But now economists are worried that the so-called zombie companies will be a drag on the economy. Well, DW correspondent from Berlin, Stephen Beardsley, joins us on the program to discuss this new development. Well, good afternoon and thank you for joining us.
Good afternoon.
Well, so about the zombie companies, first that term, it hits you in one way, but is it a bad thing really to prevent businesses from going insolvent?
No, I think of course not, especially when you look in terms of this corona pandemic. The idea was, of course, to help out those businesses that were suddenly just cut off from all sorts of revenue that they otherwise would have expected. It's hard to plan for a pandemic, and a lot of otherwise healthy companies could not have planned for it, and they needed the help. This was one measure of many that Berlin has sought or has gone after to help companies, including such things as payroll support, including cheaper loans and grants that don't have to be paid back, so that companies would get help making ends meet, and that employees would not be cut off. The problem is that the economy has sort of a self-cleansing function, which is that some businesses that can't function well, that can't make ends meet, they do go out of business, and that helps them, that pulls them off rather the books of suppliers, of banks, of landlords, and allows them to then search for clean credit that's actually out there and coming in. When you have a hold on insolvencies, then you have a bunch of companies who, once the good times are back and the help is pulled out, the waters recede again, they can't really make it. And so suddenly what might happen, this is what economists say, is that the banks, the suppliers, the landlords will suddenly find that they have a lot of bad clients, that they have a lot of bad partners on their sheets, and they could be threatened with insolvencies. And a lot of this is coming out of a new study by a credit agency here in Germany that looked at payments from companies recently, looked at a lot of other data to say how many companies out there are just sort of zombified. They're just sort of walking around and they're only kept alive because of the state support right now. And so there is a fear that if this insolvency suspension is lengthened, which is the discussion right now in politics, that this will only get worse.
It sounds like a debate on natural selection, but let's talk about recovery generally, economic recovery in Germany, right? Now, on one hand, I heard this about some calling for a 4-day work week, and then there's the need to actually get back. I'm talking about the economy. So how is that being balanced?
Well, so the economy is rebounding in some ways. We've seen that exports have risen in the last quarter. We've seen that that's pushed up factory output. But there are industries, such as the car industry, for example, that frankly was suffering before the pandemic hit. And now the demand that they were dealing with, the low demand, is going even lower. And that means that there's less output need for them and that they're already over capacity. So what happens to all those employees who are connected to that industry? That's estimated to be about 800,000 people across Germany. That means that they could be sent into the unemployment ranks. Well, Germany doesn't want that to happen, and so they are considering measures such as, I should say, it's been suggested that a 4-day work week could be a solution. The idea is that the state pays for that fifth unused day. It pays a subsidy to those employees, and that the businesses keep those employees on the payroll for when the good times supposedly come back. And then it can bring them back in and begin production as normal. There is a lot of problem. There are a lot of problems, potential problems with that solution, but it's seen support already from some mainstream corners, including the labor minister in the government and from one of the major parties here. So it remains to be seen whether this is a serious discussion that's going to take place, but it's an attempt to deal with what could be coming unemployment numbers that could rise pretty dramatically here.
Well, just on a final note, briefly, one other thing that seems to be rising, of course, is Germany's daily cases of coronavirus, 1,707 on Thursday. And you wonder, what is responsible for this spike?
A lot of that blame is being put on people who are traveling now and who are coming back. The travel restrictions were relinquished or were set back some weeks ago. And that means that people could go to Spain, they could go to Italy. But really, the rising cases are coming from places, two countries in particular stick out, Kosovo and Turkey. Especially in the west of Germany, where you have more migrants from those lands who have settled there several generations deep in some cases, especially when it comes to German Turks. And it looks like they're going back to visit families, and in some cases, they're picking up the sickness there, and then they're spreading it back here. So there will be a meeting next week planned between Merkel and regional governors as far as to discuss whether further restrictions need to be put in place. But schools have also started back here, and there are individual cases that are coming out. There are quarantines being put in place, but really it's the travel restrictions being lifted that's really seen as the major contributor to those rising numbers.
Well, thank you so much, Stephen, for your thoughts on the program.
Thank you.
Well, still outside the country, South Korea is reporting its biggest increase in COVID-19 cases since March, and the country managed to control the pandemic early on and was viewed as one of the world's success stories. But a new spike in cases in and around the capital, Seoul, has led to fears that the country could be on the brink of a major outbreak. One factor behind the new spike could be that some church members are reluctant to comply with COVID-19 measures. Many new cases have been linked to the Sarangjil Church, where members have attended rallies despite warnings from health officials.
South Korea has seen its highest daily rise in coronavirus cases since early March, recording 324 new cases as a cluster of cases in the capital, Seoul, are linked to churches. Over in China, health authorities in the capital, Beijing, have removed a requirement for people to wear masks outdoors, further relaxing the rules aimed at preventing the spread of coronavirus. The city has gone 13 consecutive days without reporting any new case. Despite the relaxed guidelines, a large proportion of people continue to wear masks in Beijing. In a speech accepting the Democratic presidential nomination, Joe Biden criticized President Donald Trump's handling of the pandemic in the U.S., saying he has failed in his most basic duty to the nation.
Our current president has failed in his most basic duty to the nation. He's failed to protect us. He's failed to protect America. And my fellow Americans, that is unforgivable.
The Australian state of Victoria has seen daily cases drop under 200 for the first time in over a month. Prime Minister Scott Morrison called it a week of increased hope, but officials said it was still too early to ease lockdown restrictions.
We'll take a look at our website, channelstv.com, where you can find the latest updates on the pandemic. And all you need to do is log on to channelstv.com. You find stories like this one, why there is an upsurge of cases in Plateau. That's credited to the state government. Well, that's the COVID-19 update for this afternoon. Thank you for watching. I'm Kayode Okikiolu. Do stay safe.